still some people joining. But I want to be cognizant of everyone's time. And then also just to let everyone know, as you heard, this is a recorded webinar, so that we will be able to log it into our learning management system at NCSD, so that those who are not able to make today's webinar will be able to listen to it at a later date. For those who I do not know, my name is Leo Parker. I serve as the Director of Prevention Programs at NCSD, and I also serve as the liaison to our MSM Advisory Committee at NCSD. And so I do have the pleasure of having Luke Anamani here with us today. And Luke is the visionary CEO of Commando. And so Luke will be sharing with us some experts in LGBTQ plus digital marketing. We thought that this would be pivotal for a lot of people who may be interested in knowing more or wanting to get more into the LGBTQ digital space, to do some marketing or discussions for their health department. So I will turn it over to Luke at this point.
Thanks, Leo. Appreciate the time to go through this with everyone, and feel free. I think, Leo, are we going to have questions at the end?
Yes,
Or
we will have questions at the end. Also, if people have comments or anything, feel free to drop them in the chat. I will be following along with the chat during your presentation and pull out any important questions that may be found there also for you, Luke.
sure. Okay, I'm going to go ahead and share my screen. Everyone, let me know if you can see it. I'm just going to make it a full screen so I can see it here. Well, it's funny because everyone wanted to put a picture of me, and I was like, well, they're going to see me. So I put me as a bear, as a commando bear. That's what I would look like. But, just to go over a little bit of my experience, I've started in 2012 working at Grindr, which I had previously been in print sales for like Yellow Page ads. And it was quite a change and something really interesting. Grindr was it was the first ever dating app, gay, straight, or whatever. So it was a great experience to learn, really guiding people because nobody had ever heard of doing advertising on a dating platform. So, we learned as our clients learned, and have been able to sort of use that learning and expand on it. I left Grindr in 2018. They had really made a big focus on going after national accounts, and I knew that in the community, especially the LGBTQ community, it's really important to connect our local clinics, local health departments, local research study universities to the community, and was able to start Commando in 2018. It actually started with one of my clients, which is UCLA, that does a lot of health research in the community. They didn't know what to do. They called me and said, Luke, we don't understand advertising in general to the community, and we're scientists, so we really need your help. And that was the beginning of Commando. As of today, we've grown from 0 to about 350 clients throughout the US. And I'd say that's sort of split a third health departments, a third health clinics, and a third in health research in the LGBTQ community. So today, what I want to do is go through some of the different ways that we can really have success in reaching the community on a digital front. And I know in today's world with funding and a lot of things, it's a lot more difficult, a lot more challenging. There's more platforms than ever. So my goal today is to go through, in general, what are the successful ways of doing advertising to the community, and then actually showing a lot of you that haven't had the opportunity to be on some of these platforms, how it works, how it looks. And then, at the end, we'll do a little fun activity where, we look at different ads, what worked better, and really give you some guidance. So in the future, whether it's with Commando or it's on your own or with someone else, that you have some good highlights in terms of what to do to be as successful as possible in the space. So let's start with the top 5 keys to a successful campaign. We're going to go through some of these, but I want to sort of start you on things to think about. The first thing is just a clear definition of campaign objectives. A lot of times, you have to be a little flexible. An example would be a lot of our clients that are introducing PrEP and DoxyPEP to the community. That is their goal, so they want to do that. But one area that sometimes is missed is what is the beginning of getting someone in the door? It's really the testing aspect. People come in to test, and then the providers can talk to them, or the clinic can talk to them more about PrEP and DoxyPEP and ways to help prevent STIs and HIV. But a lot of times you might have to look above and beyond what your initial objectives are to have a successful campaign. Um, Number two is reach your target audience where they're at. We're going to get into this pretty deep in terms of the different platforms. I'm going to tell you something that you all probably never knew at the end in terms of what we're seeing, because we have all these campaigns running, and we see the data, and there's a lot of things that we're seeing that are not what you would expect. Number three is impactful ad design and landing page development. This is probably the most crucial of all of them because the ad design needs to stand out. I do understand that depending on where you're located, there's certain things that we're not going to do a "do you swallow" PrEP ad in every single county, city, state, based on some of the things that you all face. But having an impactful ad that stands out that people can identify with is very important. And even more important is, where do we send those people that are interested? Even if you're not actually seeing patients and you're a health department that is trying to increase awareness of PrEP, one thing Commando really tries to emphasize is you have to have a landing page that has the data and the information for them to do the next step. So if it's a PrEP awareness campaign, you want to have, hey, here's where I can get PrEP. Here's a number I can call. Here's the next step. Rather than maybe in the past, it was really like PrEP helps prevent HIV. So, I think now we're evolving to where we want people to take an action, and action is going to be a big part of what I talk about today in terms of what a successful campaign is. Number four is optimization and reporting. This is, whether it's you, Commando, or someone else, looking at these campaigns, seeing what's working, what's not, and then reporting back to you on, what the overall spend was. Here's what platforms worked well. Here's what platforms could see improvement. So really understanding that is important for the campaign and also for future campaigns, and then analyzing the results and next steps. So this is really important to understand what was successful. I think even more so, this is probably one of your biggest challenges is if you're setting up a digital campaign to our community, a lot of times you're not potentially on the front line when people are coming in. So communicating to the clinical staff, letting them know what's going on, even if it's not your clinical staff and it's just different partners. I know we work a lot with Rhode Island. I know Thomas and Aaron are on the call, and they might have certain areas where they're trying to connect people to the partners that they have that will do some of these services. So really an important part of it. So now I'm going to go into the three different ways that we see success on digital. The first way is dating apps. And, in general, there's now a lot of different dating apps that are out there. What makes the dating apps the most very powerful is, in today's world, privacy is above anything. All of the different platforms, whether it's social media, search, there's a lot of different privacy things that are in place. With social media like Meta, years ago, you could target based on gay, bisexual, certain things. Now there's no way to do it. So when you're doing an ad on Grindr, Scruff, Jacked, Her for the lesbian audience, Sniffies, you're making sure you're in front of that audience. There's no question about it. So that is some of the power to it. And there are still some challenges to it, which we'll get into as well. But what I want to do now is take you in to see what a campaigns actually look like. And I use some real life examples in terms of the ads. Grindr still is the largest. So we know, there's over 1.1 million people on Grindr in the US. We do know the age breakdown is 70% are 18 to 34. So it is a younger, high risk audience. A lot of questions I get is sometimes, what is the diversity? Where, like, in terms of, ethnicity and race, and that really follows your own community. So, we work with St. Clair County, Illinois, which has a very high African American community. So we see higher numbers there. So it's going to be representative of the community there. in your backyard. With Grindr, they have display ads like you see here. There's 3 different sizes, and these can be targeted very specifically to a county. They can be targeted to a city. They can be targeted to a zip code. They can be targeted to a state. So there's a lot of flexibility in terms of how these ads work. In terms of some of our real life examples, like we have this fall self-care hot list where it just combines different initiatives. We talked earlier about understanding the initiatives you're going to go after. A lot of times with funding being a little bit more challenging, you might have to put a couple different initiatives on an ad to get people's attention and maybe make it around a sexual health initiative in general. So the way these ads work is all they have to do is tap on it with their finger and it goes right to the landing page. In terms of results, we're able to see how many people were shown the ad, how many people clicked on it, and that comes up to a click-through rate that we can tell you benchmarks and explain exactly how it works. One of the beauties of Grindr is you're paying for performance. You're paying for how many impressions or views of the ad that you're getting. So it does put you in a powerful position if you have a budget that needs to last a long time. Grindr can split it and you can have a daily budget of impressions every day for 6 months, for 3 months, for a year. But it does make it easy to have that daily visibility on the platform, which some of the other platforms as we get into won't offer that. Grindr just recently this year launched a sponsored profile ad. When I worked there, as a salesperson, I wanted this ad 8 years ago, but finally they did it. So far it's really meant to be an awareness play. In the top left, where a profile exists is where your ad would be. And you can be creative and have like a sexy guy in the icon. You can have, a bottle of prep. You can do a lot of different things there. But this ad unit is a very new ad unit that they allow you to be more targeted. So you can target by city, state, county. And it says it can run from 1 day up to 30 days, but it really depends on the market. Like, for example, we work with the state of North Dakota. We've ran this over 6, 8 months because the population there is a little smaller. We can extend this out and get it to run over longer periods of time. But it is a new ad that so far the click-through rates and the engagement is probably about 4 times what you see with the display ads. It is a little pricier, but in a large market where you can get that across, or a smaller market where you can spread out the spend over a long period of time, it can be very successful. So now we go into Scruff and Jacked. So Scruff is the second largest platform. With the way the ads work on your phone, when you open up the app, you're going to get served a full screen ad. Once someone gets that ad, they can tap on it to go to your landing page. Even if they dismiss it, because there are going to be people that go on the platform at the middle of the night or something, and although they might be interested, they're not interested to move forward at that point. So even if they dismiss it, on the left side, there'll be an inbox that says ready to score or get tested. And all they have to do over those 3 days is tap on it and it brings the ad back. So this is considered more of a takeover. So you really own that space on Scruff and Jack for that 3-day period. So the upside is everyone that's on the platform that is not a paid user is going to see your ad. They don't have a choice. The downside is it's going to run for 3 days. So if you have the budget to do, one every month or one every couple of weeks, it is a good ad unit. With a limited budget, you might want to avoid it just because you want to get the most time frame out of your ads and make sure they're most impactful based on the budget that you have to work with. Jacked is owned by Scruff. They bought Jacked, I'd say about 4 years ago. They've done a really good job with it to just make it consistent. So with the ads, it works exactly the same as Scruff. The only difference is the population on there, 70% of the users identify as African American. Now, although a lot of clients will reach out to us, and this will be I want to be on Jack, which is totally a good platform to be in. It's really important that you understand the demographic that you're hitting. Like, for example, in a state or in a county that has a minimal African American audience, you might be paying a premium to be in front of 100 people, where that same money would be in front of 10,000 people on Grindr, which would still equate to hitting a larger African American audience. So now we're going to get into some of the tribal platforms. Growler is the largest bear community platform, and although it's a smaller platform, the ad is very easy to use. It's a text message, so they get send a text message. All they have to do is tap on more if they're interested in moving forward, and we've seen a lot of success, especially like I remember a couple different campaigns where if you're doing a survey to find out what people in the community are looking for in terms of services, or if you're trying to get in front and you're in a larger city like Chicago, the bear community is a large percent of the community that's out there, and it's very diverse. You're going to see higher Latino, higher African American numbers in the bear community, which makes it even more important in terms of diversity. Then we get into some of our, I call them the discrete down low platforms, which would be Atom for Atom and Sniffies. With Atom for Atom, there's two different ad choices. One is an internal mailer, which is an inbox message that's sent to you either on the app or on the desktop. And the other is a pop-up message that almost like Scruff, it just pops up and is served to the users. The thing that makes Atom for Atom and Sniffies very appealing is when I say discrete, it means that people don't have to download an app. So if you're in a smaller community that's very rural, and potentially if someone launches Grindr, people are going to see their profile and potentially know that they're out. There's a lot of things that these platforms offer in terms of discreteness because they can go on their phone, on the desktop or mobile web, and they can browse, and nobody really knows it's them in terms of this. It's very similar to in the olden days when we had Craigslist. People could go on there, they could chat, they could hook up, and it was very like you could have a partner, something they're not going to see Grindr on your phone. So something like Sniffies has began to emerge, and Sniffies, I would say right now, is borderline probably the second largest platform, very close to Scruff. With Sniffies, it's an inbox message. So this just means that they've integrated into their platform a chat message that you can send to people in your community about the services you offer. This says prep yourself. If they were to tap on it, they would pull up this full screen ad you see here on the right. And realistically, Sniffies is like Grindr meets Google Maps, where you're going to see where people are on a map grid. It's very sexual. It's very hookup centric. You're going to see that, if you're doing harm reduction, addiction, that kind of thing, Sniffies, Atom for Atom might have a higher usage in terms of that. But it is a great platform. We can target based on a radius around an area. So if you're in a county, we find the center of the county and do a radius around it. If state, same way. Or you can actually just put in an address and do a radius around the address. So really cool and an innovative platform that has really taken off. So Tinder is the world's most popular dating app. With Tinder, we do know it's definitely still a younger audience. One thing that we've learned is you can get in front of sexually active people, obviously, on any dating app. With Tinder, you can't target based on sexual preference. So if it's specifically like Mpox is a good example. The gay male community was at the highest risk. So when you do messaging, you can't pinpoint it. But, we did a campaign for Miami Beach where Tinder had like a 6 or 7% click-through rate, which is 5 times what you'd see. So it's a great way if you have a general STD testing message that wants to get out to the public. Getting on Tinder is really good in terms of numbers. It's by far the largest, so you're getting in front of a lot of different people that are definitely dating and are out there and could use a reminder in terms of sexual health and the importance of getting tested or prevention. Her is the largest lesbian platform. Just about a month and a half ago, Her got purchased by Match, which also owns Tinder. What this means, it's actually beneficial for local health departments and clinics because now that Her is purchased by Match, it allows you the ability to buy ads on an impression basis. So you can buy a certain amount of ad views over a long period of time, where in the past, when Her was owned by the owner there, It had a higher ad buy minimum. It was a little bit more difficult. Now that Match is a part of it, they have a native display, which you see on the left, and then they'll have a video ad. So you can even do a 15-second video that runs. These ads typically will get a click-through rate anywhere from 1 to 2%, which typical digital click-through rates could be as low as 0.1%. So when you hear 1 to 2%, it might sound a little low, but it's actually really, really good. But the moral of the story is this is a great community. Her is very large. It's similar to Grindr. It's just targeting the lesbian community that is out in your area. So that sums up the dating platforms. So before we get into social, I've mentioned that there's one thing that I'm going to tell you today that's going to be surprising. Um, One thing I've noticed is people that are reaching out, a lot of them understand and already know how many, like where they want to advertise. Or like, hey, we want to go on Grindr. We want to go on Sniffies. And one thing that we've learned based on tracking a lot of these ads is if your goal is to get an action, to get someone to get on PrEP, to get someone to get in and get tested, social media is by far the best. It's not even close. When we have a campaign, and let's say just for easy math, it's a $10,000 campaign, we typically recommend 50 to 60% of that budget to go here because that's where we see the leads. We see people reaching out from Instagram, Facebook, TikTok, Snapchat. Now, do I love Meta as a company? No, I hate them more than anything, but we follow the data. We know what's happening based on how we track ads. And although the challenge that I feel that you all go through is in your community, when you do ads on social media, it's gonna go to people. They're gonna see it. And sometimes that becomes more of a challenge in terms of how people respond. Are they commenting on ads? So it becomes a little bit challenging just to make sure that there's not a lot of ruckus that is caused by it. But when we look at overall results, and this just gives you an example like Meta, which is Facebook and Instagram, TikTok and Snapchat, just how some of the ads look. One thing to understand is, it sounds easy just doing an ad on Facebook and Instagram. There's actually 4 different ad sizes. And I don't know if you all have ever seen, but you'll be on the platform and you'll see a button covered up by copy. So it's really important that you understand all of the ways to, all of the zones of the ad to make sure that copy is in the right place and that the ad works and is engaging. But this is by far where we see the most success on digital ad campaigns. One thing that you might be thinking is, well, if you do an ad on Meta, how do you ensure that it's targeting the LGBTQ community if you even can do that? And I mentioned earlier that they've taken out some of this LGBTQ ability to target. One thing at Commando that we've been really fortunate is we've been doing campaigns now for over 7 years. And as we do campaigns, we're building up a larger, more robust lookalike audience, which just means we're able to see, who's responding, who's reaching out through these ads, and not target those people, but target people that are similar. So it makes sure that the reach and relevance of who you're trying to hit is still accurate, and then it's cost efficient, meaning, if you're doing a message for STI prevention, you have an idea of the age ranges you want to hit, the demographic you want to hit, and we can get in front of that demographic very accurately, where if you just go on tomorrow and you create a campaign, it might take 6 months to a year for you to understand and to learn. Because Meta and ads on social media, they're in essence like a baby, an infant. They start out and they're trying to learn and they learn more and it gets better and better and better. But it does take time. And that's the advantage sometimes of what we're able to do is really use, being one of the companies that was on the forefront of MPOX and working with a lot of you all as partners to try and get that message out quickly around awareness, around vaccination. This has really given us the ability to be more targeted with campaigns that really make sense in reaching either LGBTQ or strictly the gay male community. Last but not least, so we have dating, we have the social media side, and then we have web. Web is partly Google Ads, which sometimes people don't really recognize this, but it is very, very important to have ads on Google search because when you think of what would happen in real life, so let's say, tomorrow I get a message from a partner and says, hey, I'm positive for syphilis. One of the first things I'm probably going to do is search, hey, I need syphilis testing or I need to get treated. So this is one of the best ways to get in front of someone that wants to make an action. And also to help control, STIs by giving them an option that is affordable. Sometimes they're going to spend upwards of a couple $100s to get a test. So seeing that North Dakota has an option and has partners that will do low cost or free testing is a great way of connecting people to the community to understand the services that are out there. And then also, like, a lot of people will do searches in an incognito mode so people don't see their searches. So it's really important to have that out there and to make sure that if any time it makes sense to get in front of people, it's when they're going to search you out and look for different services, whether it's around HIV care, PrEP, testing, DoxyPEP. So really, really an important aspect of any campaign that we recommend. We also work with LGBTQ web destinations. So, especially during MPOX, people were really looking for content around, hey, what's going on? Where's the vaccine? All these different things. So, depending on what the initiative is, we can reach out on some of these different platforms, whether it's Pause, Advocate 80. These can be really good platforms to reach. This is a true awareness play, though. Like if you're looking to get people in the door, the LGBTQ web destinations is not the goal. This is really more about letting people know, whether it's smoking cessation, Mpox vaccination. We're just trying to get an awareness message out there to the masses. And we do know the same with the dating apps is most likely if they're on these platforms, they're a part of the community. So that's what makes the reach very important. So that sums up the actual different platforms. Now, you may be wondering, like, why didn't Luke talk about Hinge and Bumble and some of those other platforms in the dating sites? And the reason is many of them don't offer ads. One thing that I learned while I worked at Grindr is the ad side is a very small part of their business. Many of these dating platforms make about 90 to 95% of their money on premium subscribers, which really only makes up about 10% of their entire audience. But it's really important to understand that because not every platform is going to offer ads. So we've found the ones that do that you can be more targeted on, and we can lean into those and be very successful. So we talked about some of the keys to a successful campaign, and creative was a big part of it. This is a couple different campaigns that we've done just to give you a sense of the look of the ads. We partnered with Ginger Minch, who's on the right, Prep, Get On It, Darling. The ad's pretty and it stands out, but in terms of actual results, it's done 3 or 4 times better than any ad we've ever done. So sometimes you can overthink things, but the data will tell you, hey, this is what works. I'm going to get into some of the different ads and how they perform, but one thing that came to Commando through the Mpox outbreak is people are reaching out to us saying, hey, we need a campaign up in 2 days. So what did we do? We decided to build an ad template platform. So for PrEP, for testing, for syphilis, for HIV care, we have a set of ad templates ready to go. So tomorrow we can get a campaign up if there's a syphilis outbreak or something like that. But also it helps save you time because I know many of you have probably ran campaigns, and one of the parts of the campaign that can be very challenging is the ad creation, where either there's a lot of cooks in the kitchen and everyone wants sort of an idea on it, or it just takes a lot of time from the time you see the ad to you change it. So having this library of ad templates can speed that process up and take time away, add time to your calendar that you don't have to spend in ad design. And then the landing page aspect, this is really important. A lot of times with Commando, we do not charge for the ad creation or for any landing page development if you need it. What we try and do is if you're running a campaign, our goal is to communicate how that campaign worked. And reporting doesn't always do that. It's going to tell you, hey, you got 5,000 people went to your website, which is great to know. But a lot of these landing pages can tell you How many people filled out a form that were interested? How many people tapped to call to schedule something? Um, so it's giving you a little bit more data. So then you could take that data and share it with, everyone involved and say, hey, we invested this and this is the kind of return. And even if you're running your own campaign, you want to make sure that the landing page is very mobile friendly. I think sometimes we forget just everything I talked about today is about 94% on your mobile device. So it's super duper important that if you're running an ad campaign to your website, that it's very specifically easy for people to know what to do and that it's mobile friendly. I always refer back to the We Know What You Did Last Summer, which was actually a STI/Mpox campaign we did for the state of Nebraska. And I thought it was great. It was funny as hell. And they also had a nice list. You can't see it here, but they had all of their partners. So it would have like, let's say 10 or 12 different clinics with their hours, what services they offered. So once again, if the goal is awareness, we still need people to take action. So it's really important to do that and to set them up to where, hey, they're interested in prep. What's my next step as a person if I want to go and take that next step? And that's really an important takeaway for any campaign that you do. Now I'm going to go into a couple different actual real life campaigns we've done. I mentioned Rhode Island a couple times. We were able to work with them during the Mpox outbreak. Show you a couple ads that you see. Actually, that Mpox ad on the right, I think I might have Aaron correct me, but I think it was like a 10% click-through rate or something, really maybe 20%. But really an amazing campaign. We got a call from them. They told us, hey, we know Mpox is out there. There was no vaccine at the moment. So we started really with just knowing the signs and symptoms, avoid close contact, trying to get people to understand and to be aware of what's going on. And then once the vaccine came to be available, then we transitioned it from that to really get vaccinated. And the outcome of it was Rhode Island was ranked #1 nationally in 2-dose coverage and #3 for 1-dose coverage. So they did really great, and we're able to really get the message in front of the right people. I mean, we even did like movie theater ads, and they were very aggressive of going, outside the box and doing whatever it took to get the message out to the community. Then we did a campaign. A lot of times in today's world, there's a lot of different HIV and STI testing kits out there. Going to some conferences, the technology is getting even better. I've worked with First to Know, which is like a syphilis in-home test, which I think is amazing because I always remember syphilis was a blood test. It wasn't something you could really find out immediately. So with Lynn County, I love telling the story because it's a smaller area. Heather, who is our contact there, one of the things she said when we were interviewing is we're public servants with a lot of different strengths, but advertising is not one of them. So they gave us the trust to do it. After 1 month, they saw over a 300% increase in the test kits being sent out. And it really, in general, their goal was to get this in front of sexually active adults. It wasn't just LGBTQ, but that was a big part of it. And they wanted to be fun. You can see what the ad was one of our models from our photo shoot. So just trying to be fun, engaging with the community, and it worked out really well for them. Last but not least, I've told this story a lot, but I'm going to continue to tell the story. We work with Music City Prep Clinic, which they are in the state of Tennessee and the state of Kentucky. In 2018, they had about 500 patients. And in general, just in the whole state, there was 2,600 people on PrEP. As of this year, there's over 11,000 people on PrEP with 24,000 patients for that clinic. Out of that, over 4,500 of them, I believe, are actually getting monthly PrEP, which has really helped them with their 340B revenue to be able to continue to grow, continue to serve the community. They brought me this Feeling Thorny ad with the cactus, which is horrible, and we were able to turn it into a Knockin' Boots campaign that really did well and launched it really into an amazing success. So what does that mean? Well, just recently, they went into Memphis, which, as you all know, Memphis has one of the highest, if not the highest rate of HIV in the nation. So our goal was, how do we take what we've learned and try and get into a community like Memphis that is way more discreet, way more on the down low, with the message that's not just gay men, not just men, but really also offering the services to the female audience that is even at higher risk of HIV. So you'll see a couple of the different ads that we did, really trying to get just a totally different look. Even though this is Music City Prep Clinic, it looks nothing like it. We branded it totally different. The goal is like leaning into sports where people are in Memphis, love basketball. They're into it. And what have we seen? This started in June. Already they're at almost 300 new patients in the first 6 months. And they're identifying people that are positive. They're getting people on PrEP. They're getting people on DoxyPEP. But this is going to be, the future is going to be bright in Memphis. Although right now you'd look at it and be like, they have a problem. So it is something that we're taking what we're learning, we're applying it, and in a lot of cases, it's getting in front of that audience that everyone knows that we have to reach, because it's not specifically just gay men that are out there at risk. There's a lot of other communities and demographics that are. So now the fun part. I'm going to go through a couple different ads just to get, since this isn't live, I'm going to just give a second between each one. But a lot of times you might think one is the winner and you'll be surprised in terms of ad performance. But when we're looking at and summarizing what makes a successful campaign, let's look at some real life ads and how they performed. So this is Prevention X, which they're a nonprofit clinic out of Florida. They do an ad for like coverage in terms of insurance to get on PrEP and DoxyPEP. So option 1 on the left, option 2 on the right. The winner, option 1 on the left, performed 85% better. Now, I think, having real life models is a big thing in terms of ads. Making it fun and engaging, like you can get it. The ad on the right still, 1.49 is not a bad click-through rate. It's 3 times benchmark. But to really stand out, sometimes it makes sense to have just a fun look, a fun design, and also making sure that it connects with the community. Next, we have Reven Health, which they're actually in Oklahoma City. They've had a tremendous amount of success. So option 1 is on the left. Option 2 is It's Giving Health pill, which we love. So the winner, option 2 with a 5% click-through rate. Now, I want to tell you something about this specific campaign. If we were doing a campaign in Los Angeles and Chicago and New York, Miami, you would anticipate that click-through rate. On average, it's about 0.5%. So both of these are amazing. But when we're doing ads in places that don't have a lot of awareness, and Oklahoma is one. I've been working to get a client in Oklahoma for years and years. But now that they're running this 5% click-through rate, what does that tell us? It tells us that there's not enough exposure. People they don't know what PrEP is. So when you run messages and ads where there's just not been a lot of awareness, a lot of messaging, you're going to see people really respond at a higher basis. Even like North Dakota, which I've mentioned a couple times, some of their Google click-through rates are 15-20%, because not only is it a little bit new for those markets where maybe there's not a lot of clinics that are promoting, but in general, there's just not a lot of options. They don't have a lot of people to choose from. So, you're going to see higher click-through rates in places where maybe there's less services available. Last but not least, this is Mecklenburg County. We've worked with them for a long, long time. They do amazing campaigns. They do really good work. We helped them actually create the Getting to Zero logo that you'll see in these. These are both testing ads. The question is, when you're doing a campaign, do you stick to your traditional evergreen ad on the left, or is it worth taking time to create an ad for the fall, a more seasonal approach? Is that worth the time of creating the ad, implementing it? So let's see what the answer is. Yes, it's worth it. Almost 50% higher click-through rate on the fall ad. And this is one thing, like, Heather said it earlier, you might not have a lot of experience in the ad world, but one thing we know is you want to do both. Like, just because the fall ad has a double the click-through rate or 50% higher, it doesn't mean that you only run the fall ad. You run both because you want that diversity, but it's worth taking the time to create stuff and And we've tried as a company to consistently do ads for the fall, for the spring, for the summer, for Christmas, for Thanksgiving, just things that will connect to people and get them to be really engaged. Also, you'll notice the image is very LGBTQ focused. We're representing the community in these ads, which plays a part in terms of how successful they've been. So just want to go over some of the stuff we learned, like how do you get started on a campaign? Understanding what are the objectives? Is it raising awareness, increasing testing, preventative measures? Is it all of them? So that's really important in the beginning to understand what do you need to do in terms of what is the goal of the campaign. Understanding the demographic of your at-risk population. So sometimes it's not just gay men. In Memphis, it's everybody, really. But understanding that so the best way to approach it. And one thing I'll tell you is if you have a specific demographic in mind, there's not always a way to target them. If you're trying to target, specifically by ethnicity or race, you can't. So the best way to do it is to be representative of that community in the ad so it connects to the determining the goal of your campaign. Do we want to get testing numbers up? Do we want to lower transmission rates? Do we want to get more people on preventative medication? So, that's really important. One thing that we've learned in the public health world is understand like providing high quality resolution logo files and brand guidelines. I think for a couple different counties and health departments, they've asked us, like I mentioned, Mecklenburg getting to zero. We created the logo, but it's really important that you understand that and that you have it, not, just so if you're ever to do a campaign, no matter who you're using, that you have really the highest quality logo or brand guidelines so people understand what you want, especially in a market or, if you have a specific brand that you want to stick to. Securing your budget, this is something that's become more and more challenging. Over time, things have gotten a little bit more like you have to be on more platforms sometimes to get engagement. But just understanding not maybe what exactly your budget is, but what's a range in terms of what you have to accomplish the goal, and then how does that measure up against what your objectives and what the goal of the campaign is? Because I've had people say, "Hey, we have $2,000 and we want to bring in 150 people." Like you have to be aware, does the budget match what your goals and the campaign objectives are? And then understanding what the start and end date is. This, I think, is really important because a lot of times in the past, I've seen people that reach out only for Pride or only for certain times of the year. And the clients, the health departments that we see have the most success are the ones that do it consistently. They're doing it from the beginning of the year. I don't care if it's snowing, they're still having a message around prevention, testing, that kind of thing. It doesn't have to be a high amount of a budget, but don't just push your budget only in one time of year because people need to know about these services year long throughout the year. And having that is really an important part of a successful campaign, not just pushing a large budget through a short period of time. Really trying to get the most out of it time-wise is really important. I know sometimes there's other factors at hand that you have to do that, but for Commando, whenever we work with clients, we try and get the most time out of the campaign if we can, so that message has time to resonate in the community. And with that, I'm gonna bring Leo back and we can open it up for any questions.
Thanks so much, Luke. I'm sorry. I was trying to get myself off of mute. We do have one question in the chat that I'm trying to get to from Frank.
Yeah.
And it says, will paid users still see the new sponsor advertisement?
Yeah, so that's a good question. No, they won't see the sponsored advertisement with Grindr, just because, from experience, about 93% of the users are not paid users. So those 7% that are paid, they're paying to not see any ads. One thing that's really changed at Grindr is you can now buy a la carte stuff. Meaning, let's say I decide to take a trip to P-Town and I'm not paying for a grinder extra. For that week, I could pay $9 and see more people. So they have a lot of options where you're not a full paid user the entire year, or the entire month, but you can a la carte add some different things to what you're doing, based on traveling and things like that. But yes, they do not see any ad at all. And then with Growler, it's an internal message pop-up, I believe, not externally to a user. So yes, that's correct. You on Growler to see the pop-up message, you have to actually launch Growler and open it for you to see the message. It won't send it to your text like an alert. You have to be in the platform for it to be seen. Good
And
question.
then Tom dropped a question into the chat also asking, can you comment on reaching Spanish speaking people?
Yeah, so there's two different ways that you can reach Spanish people, the Spanish speaking people. The first is on some of these platforms like Grindr, if you have a set of impressions or ad views, you can take about 15 to 20% of those impressions and serve it in Spanish to try and get that those ads out there and get engagement. What I recommend even more than that is making sure that when you do ads in Spanish or even other languages, I like to do it in social media because you can select based on what language that they select. So you can make sure that people that want Spanish speaking language ads, or they want to be communicated that way, we can serve ads just to those people. So it tends to do really well. But when you have a specific budget and you're trying to get in front of that community, you want to focus more on the social side because you can ensure that you're getting in front of people that are going to understand it. An example would be like Scruff or Growler. You wouldn't probably want to do a message in Spanish because it's going to go to every single user, and it might not resonate. You might want to maybe incorporate that you speak Spanish or you work in with that community, but you wouldn't want to do a full ad in Spanish to every single person on the platform.
Thank you for that. I don't think we have any more questions in the chat, but I do see Julia has raised their hand. So, Julia, if you want to come off of mute, please feel free to ask your question. You're still on mute.
Thank you. I I will literally never learn that, no matter how long we've been doing this. Thank you for a fantastic webinar. My name is Julia. I am joining from NACHO. We're the National Association of County and City Health Officials. Exciting to see multiple examples up here. What I'm wondering is what tips or strategies might you have for health departments that are looking to continue or expand their digital marketing, but maybe are facing funding restrictions or even content or language restrictions due to recent federal funding and guideline changes? Has that been a question that you've encountered before?
Yeah, especially this year.
Hmm.
So there's really two things. The first is a lot of the clinics, like I showed the Music City Prep Clinic, if the actual health department is giving out prep or is an actual 340B clinic, there's revenue to be had there. I know most times they aren't, but in the event that you're a 340B provider, there's a lot that you can do to help generate revenue to then fund this. So that's number one. Number two is if you're not, um, sticking to the platforms that are getting the most action. So an example would be if it was 10 years ago or 5 years ago, maybe, and you had a budget and you could be on every single dating app I just talked about, that's great. But in today's world, that might not be feasible. So
Hmm.
what do we recommend? Going on places where you can get the extended run. So maybe avoiding a scruff where you're only going to be on for 3 days and running on Grindr where you could be on for that same amount for 2 weeks or 3 weeks or a month. So it's just extending it out as long as you possibly can and leaning into the stuff that's going to convert, that's going to get people to make an action, so that whatever that budget is, that goes to the maximum exposure. I'm going to get to you, Frank, but before that, it sort of leans into what Neil mentions here is the comparative success of print ads like buses, subway systems compared to dating hookup sites. That's a good one. This is very much like the question where it's like in the past, yes, you'd want to potentially do both. the benefit of doing dating apps sometimes over the buses and subways, there's no way to connect 100% with who's going to see it. So if you have a 30% of your budget and you put it in buses and subway or whatever that display ad looks like, you're getting the message out there, but we can't really pinpoint who's seeing it. And for example, if it's an MPOX message or if it's a PrEP message or something where we really want to be targeted to the community, digitally, I can get people here where they're spending a ton of time. They're locked in on this device. So it can really perform at a higher level than some of those other things. But like I said, if you have the budget, it's best to do billboard, do everything. But in today's world, if you have to pick or choose, digital just gets you in front of the audience at a higher level, and we know 100% who's seeing the ads. Frank?
Yeah, and just to piggyback on that, when we're counting our dollars, keeping in mind that oftentimes um, billboards, buses, underground trams, etc., they don't take your ads off right away after your run. So sometimes you may get 1 month, 3 months, 4 months if it's a quiet month and your ad may run for a little while. But I think you also have to think creatively on those if you're using a web tracker or a QR code if you want to track that. So I think what I always take away is the overlapping, how often you can have that consistent branded message. But what I wanted to do, and Luke, as usual, thank you for some brilliant conversation here and really giving great suggestions. Just to remind folks that CDC still offers the UTAPs using technology to advance prevention support to health departments, city, state, local, and territories who would like to consider how to use this in your disease investigation. And oftentimes we will help work on some of those similar questions that come up along with some other folks on how to leverage, because one of the conversations that I hear quite a bit is our programs don't want to do the effort to do the DIS in a lot of populations. So sometimes a way to sometimes a way to overlap the concerns about advertising is to say, well, if you don't want us to do DIS work and approach those populations where we need to, we could leverage less time and money, maybe because you have less staff, by using the ad systems in the places where our data, and that's the key piece of this, where our data is reflecting people are engaging and meeting partners that have potentially infected. So sometimes it's language, it's really framing it in a way, well, if we don't have the people to do the work, this is a way to get them passively into our ad sites or into our clinics via the ads, and it's engaging where we know they are and our data. And that's one of the reasons why we will say to every health department who comes through for us to make sure you're collecting when you're working with patients, where are you meeting those patients? So it's just a way of sometimes rethinking it for those departments and those programs that are being a little more resistant, either because they don't have the funds or there may be restrictions on how they are spent. So just a couple ideas, but we are still here. The toolkit's still available. I'm still doing, myself and Rachel and the team are still doing technical assistance individually. We're back in action. So you can reach out to me and I'll put my email address in the chat in a moment. Luke, once again, as usual, thank you. And thank you for Leo and NCSD for organizing this today.
Yes, thank you.
Thanks so much, Frank. I know we have about 5 minutes left in time for the webinar, so do want to pause just to see if there's any other questions before we do a wrap up. Luke, if people want to reach you after today, how can they reach you?
So I'll go ahead and put in the chat my email and info, and then I'll also send it to you, Leo. So if you want to forward that over, you can do that. I'm sending that now in the chat.
Awesome. Thanks so much for sharing your info, Luke. And just as a reminder, this webinar was recorded, and so we will share the recording as well as Luke's slides, if that's okay, Luke,
Sure.
after today. to everyone so that everyone can have access to this and share with their colleagues. And once again, we appreciate your time, Luke, for sharing with us, and we appreciate you all for joining the NCSD MSM Advisory Committee. And if we don't chat anymore, I hope that everyone have a wonderful start of 2026. So thank you everyone for attending today.
Thanks,
Luke, is
everyone.
there anything
Appreciate
you'd
it.
like to share?
No, just thank everyone for your time. I'm here and available for whatever questions you may have. So excited to be a part of this and do whatever we can to help.
Awesome. Thank you.